If you've listened to my podcast for a while, you've probably heard a few news segments about the healthcare industry and healthcare reform. Here in America, healthcare is an industry built on profiteering. The medical lobby is the biggest lobby in Washington, and unfortunately, they don't advocate for patients. They advocate for pharmaceutical companies and for insurance companies who want the industry rules to be set up in such a way that they can make the most money. With this underlying motive creeping its way into Capitol Hill, it's not surprising that American medical care is the most expensive in the developed world. It's not surprising that medical debt is the #1 cause of personal bankruptcy. It's not surprising that 35,000 to 45,000 Americans die every year because they can't afford healthcare. And yet, despite all of these costs, tens of millions of people either don't have health insurance or they have inadequate access to healthcare. Because the system is so exploitative, it's also not surprising that there's a huge push for radical healthcare reform. One of the front-runner candidates for the 2020 presidential election is Bernie Sanders, and he's running on a platform of Medicare for All, which would give comprehensive medical care to everyone. Last year, I covered a story of expanded Medicare coverage in Michigan, which found that the expanded coverage got more people into the hospital, and because they could actually treat their illnesses and injuries, they had less overall stress, and they were able to perform better at work. They saw improvements across all aspects of their life, because before, when they couldn't afford healthcare, they were suffering from one or more untreated conditions. Today, I want to tell you about a recent study published in The Lancet, conducted by scientists from the Yale School of Public Health, the University of Maryland School of Medicine, and the Emerging Pathogens Institute at the University of Florida. The study examined the healthcare environment in the US and the consequences of the proposed Medicare for All Act, including patient outcomes and financial effects. So here, I'm going to read to you the abstract of the study, and then I'll discuss. So the paper says, quote, "Although healthcare expenditure per capita is higher in the USA than in any other country, more than 37 million Americans do not have health insurance, and 41 million more have inadequate access to care. Efforts are ongoing to repeal the Affordable Care Act, which would exacerbate healthcare inequities. By contrast, a universal system, such as that proposed in the Medicare for All Act, has the potential to transform the availability and efficiency of American healthcare services. Taking into account both the costs of coverage expansion and the savings that would be achieved through the Medicare for All Act, we calculate that a single-payer, universal healthcare system is likely to lead to a 13% savings in national healthcare expenditure, equivalent to more than $450 billion annually, based on the value of the US dollar in 2017. The entire system could be funded with less financial outlay than is incurred by employers and households paying for healthcare premiums, combined with existing government allocations. This shift to single-payer healthcare would provide the greatest relief to lower-income households. Furthermore, we estimate that ensuring healthcare access for all Americans would save more than 68,000 lives and 1.73 million life years every year compared with the status quo." Unquote. This is really incredible, but I've noticed that when I talk to my fellow Americans about this, they're often shocked, or even in outright disbelief, that Medicare for All saves money and lives. Because there's a lot of money at stake, and the powerful medical lobby furiously opposes Medicare for All, there's been a lot of misinformation and fear-mongering spread about Bernie Sanders and Medicare for All. There also seems to be a misunderstanding about how the healthcare industry works, and how a centralized system like Medicare for All can save money. The three biggest misconceptions I often hear about are 1. Medicare for All is socialism, and socialism is evil. 2. Medicare for All will make you lose health insurance. And 3. Medicare for All is super expensive, and we don't have the money to pay for it. Now, as I'll explain, none of these arguments hold water. The reality is quite different. The first misconception is an American classic. During the Cold War, there was an insane frenzy of anti-communist propaganda, and this established an ignorant fear of anything even remotely socialist. Now, the actual definition of socialism is a system wherein the workers own the means of production. They own the fruits of their labors, or they directly earn the profits of those labors. A real, modern, socialist institution would be a business like a worker co-op, where the employees collectively own the means of production, and they all receive a portion of the profits in addition to their wages. It's really not a bad idea, because it gets workers really invested in the success of the company, because its success directly translates to more money for them and everyone in their community. The profits are not siphoned off by a board of executives who may or may not even live in the same community as most or all of the workers. On this note, Medicare for All isn't socialism. Medicare for All doesn't put doctors in charge of the hospital. It just restructures the way that hospitals and medical services are funded. It's a more centralized funding system, which can more effectively provide an inelastic good or service than the private, decentralized market. Economically, it's not even a new idea. We recognized that a central Department of Transportation, which makes public roads available for all to use, is better for everyone than a private company making private toll roads that might cut off access to certain regions for people who can't afford to pay the toll. Just as a centralized, publicly funded Department of Transportation is obviously the superior model for empowering everybody to enjoy modern civilization, we can look to other modern countries to see how superior a single-payer system is compared to our current privatized, for-profit healthcare system. And again, this isn't even socialism. If it is socialism, then so are public roads, so are fire and police services, so is food inspection and libraries, and every other public organization that provides inelastic goods and services for an affordable price. For the second misconception, Medicare for All will not make you lose health insurance. This criticism is a nonsensical contradiction. Medicare for All means that you will have everything covered. Instead of private insurance, you're getting Medicare insurance, which will be cheaper for you and more will be covered. You won't have to worry if something is or is not covered on your plan. You won't have to worry if your preferred doctor is in-network or out-of-network. You won't have to worry about a deductible or a copay that you have to cover before the insurance will actually kick in. Medicare for All covers everything, and because it's a national system, every doctor is in-network. And this takes us quite nicely to the third misconception, which is perhaps the most widespread and the most important to debunk: the cost of Medicare for All. In the recent Democratic presidential debates, Joe Biden often made the argument that the cost of Bernie's Medicare for All plan would be $32 trillion over 10 years. Biden is trying to push this as, a talking point that, this healthcare reform is way too expensive, and there's no way we can afford it. But the thing is, Biden is being dishonest and manipulative because he's trying to scare you with the price tag, but he's not giving you the context. He's not telling you that our current system, as it is today, which is the system that he would defend, currently costs trillions of dollars more than that over 10 years. Every study that has been done about this has found that Medicare for All is less expensive. Even the Koch-funded Mercatus Institute, a right-wing think tank that despises Bernie Sanders and everything he stands for, they released a study that found that Bernie's Medicare for All plan would save $2 trillion compared to our current system. Other studies, by less biased institutions, have found savings of $5 to $10 trillion over 10 years or more. It's pretty conclusively understood that Medicare for All saves money compared to our current system. And there's many reasons why. It's not hard to understand. The most obvious reason is that with Medicare for All, there's no profit layer. There's no middleman between you and your doctor who wants to take his cut. When you're not paying more money to line the pockets of health insurance CEOs, your healthcare costs will necessarily go down. The same is also true for advertising. Pharma companies and insurance companies spend a hellacious amount of money on advertising. If our healthcare system ran through a centralized provider who doesn't need to advertise like a private company, That's a massive savings right there. Then you have to consider the administrative overhead and the billable hours that are spent dealing with our hyper-complex medical bureaucracy. Right now, healthcare providers spend an absurd amount of time and money simply managing paperwork and linking patients to their specific insurance plan, with their specific insurance company, with their specific insurance network, to see what specific treatments and drugs they can access and at what cost. There are a stupid number of variables, and it's an immensely inefficient bureaucratic headache for hospitals, doctors, and other healthcare providers. By and large, they all really like Medicare, because Medicare is a single system with straightforward billing plans. If we had Medicare for all, this nightmarish insurance bureaucracy goes away, and doctors can spend more time and energy with their patients, which leads to global improvements in healthcare and cost efficiency. There's another advantage to getting rid of this bureaucracy. Right now, there are hundreds of competing insurance companies, and because each individual company has limited bargaining power, because they only represent the customers who are paying them, they only represent that pool of patients, healthcare providers are able to demand higher prices, and this raises costs for insurers. And because they want to maintain their profits, this is part of the private mechanism, this is part of the capitalist system, they want to maintain their profits, so they raise the costs for you, the patient. If we have a Medicare for all system, the government is the sole insurer. They are the single payer. So Medicare would have tremendous bargaining power to negotiate lower prices, from drugs to surgeries to therapies. A Medicare for all system would basically have a patient pool of the entire US population. And if you want to play ball and get access to this wealthy and huge patient pool, then you gotta play by our rules. That's how it works. That's how a single payer can negotiate lower prices. Also, remember that Medicare doesn't have a profit motive, so that reduces costs for you again. Then, on top of all of this, we have to consider the economic benefit of a citizenry having affordable access to healthcare. The CDC estimates that 75% of the nation's healthcare spending goes towards preventative care services, and an inability to afford healthcare, even preventative healthcare, leads to health complications, which leads to sick people who are less effective workers. And this leads to a reduction in economic output by $260 billion a year. The CDC further estimates that if everyone had access to affordable preventative care, not only would we see an improvement in people's daily lives, we'd see massive economic boost from all of the healthier, more productive citizens, and we would save tens of thousands of lives annually. All of these things leads to a more effective, more affordable healthcare system that will benefit the most people. No longer will we have 37 million uninsured people and 41 million people with inadequate care. No longer will tens of thousands of people die needlessly because they can't afford care. And more studies just like this continue to get published, and there is now overwhelming public support for Medicare for all. We're at a very interesting point in American history. If Trump wins the 2020 election, he will likely continue his extreme deregulatory crusade, and the exploitative healthcare system will become even more exploitative and more expensive. If Bernie Sanders wins the 2020 election, and if he's able to pass his Medicare for All plan with minimal Republican sabotage, we could be opening the door to a better future, where all American citizens can enjoy affordable healthcare, where they can see their doctor without fear of financial ruin. This is a future that will benefit us all.